Welcome to today's video. I want to thank Dr. Carl Burak for taking time to talk with us today. Dr. Burak's career has included time as a primary care provider as well as a psychiatrist. With this background, he has a particularly valuable perspective on the challenging issues of detecting cognitive impairment in our aging patients.
My name is Carl Burak, and I'm a psychiatrist now, but I wasn't always a psychiatrist, and maybe that has special relevance with the group that I'm talking to. For the first 13 years out of medical school, what I did mostly was primary care, and most of the primary care was as an emergency physician, although I did have a few years of private practice, family practice, and that was my board certification back then. I eventually went into psychiatry, but I think my practice of psychiatry has been greatly influenced by the fact that I started out practicing general medicine first. One of the joys of going into psychiatry for me was to get myself out from under the time pressure that I know you men and women are under when you're in the office. It's very difficult to spend the time. So I want to share with you thoughts that come from this combination of background, because I think it's informed my thinking. We're talking about Alzheimer's from a psychiatric perspective. I think that the most important red flag for me, if somebody is not coming in specifically cognitively impaired, is a change in their mood or their personality. And this is probably more broadly relevant than just Alzheimer's, but I would say if you have a patient that you've known for a long time, and that patient has had minimal depression or anxiety, and then suddenly they come in with a caregiver, and everybody's saying, this is really bad, I don't know why she or he is so depressed, I would start to think, you don't know why either, and there might be something else going on. And that might be cancer, it might be a brain tumor, but it might be the beginning of Alzheimer's. And I think we too infrequently are looking and thinking about Alzheimer's as a memory and cognition problem. And what I see not infrequently are personality changes or mood changes that are just refractory, and they really don't seem to get better that quickly. You're going to be in a position where you will not know, but I hope that you begin to be more sensitive about those kind of changes in an older person especially, because you'll then be conscious and looking for possibilities. And it may occur to you much sooner than it would otherwise occur to you that this person may have something else going on.
Dr. Burak has shared some important clinical pearls with us today. Keep in mind that major depression can be the initial presentation of dementia. Fully 40 to 60% of patients with mild cognitive changes also present with one of the emotional symptoms listed here. Be on the lookout for depression, apathy, irritability, or even frank agitation. Next, remember that major depression itself is a strong risk factor for dementia. As persons with depression age, fully 10 to 40% of them will develop cognitive decline. A terrific review article is listed below that talks about this combined, challenging clinical presentation.